Almost every woman at some point has had severe pain or a burning sensation while peeing and has been too embarrassed to talk about it. These are basically the symptoms of a urinary tract infection or UTI, a bacterial infection of the urinary tract. The tract includes the urethra, through which we pass urine, the bladder that stores the urine, the ureters that are tubes connecting the kidneys to the bladder, and the kidneys that make the urine. Major types of infection are cystitis or bladder infection and pyelonephritis or the kidney infection. Also, women are more prone to developing infection due to a shorter urethra, due to which the bacteria travel the tract more easily. Bacteria that live in the vagina and the rectum usually do not come in direct contact with the urethra, but when they do come in contact, such as by having intercourse or wiping from back to front after peeing, they travel up the urethra and can infect the bladder and even the kidneys. Some of the factors that increase the risk of getting a UTI are diabetes, improper hygiene, having a bladder or a kidney infection in the past 12 months increases your chance of a repeat infection, any defect or stone in the urinary tract, if you are holding your urine for a longer time, then you are not washing away the bacteria that may be present in the bladder, using a spermicide for birth control, frequent sexual intercourse with single or multiple partners. Among men, those who are not circumscribed are at a higher risk. You would need a urine routine and culture examination as soon as possible. The sample should be midstream, that is, you should collect the urine sometime after the urination starts and well before it finishes. If there is fever, a blood test may also be needed. The symptoms of a bladder infection are pain or burning when urinating, the frequent need to urinate, an urgent need to urinate, blood in the urine, and discomfort in the lower abdomen. The symptoms of a kidney infection are same as that of bladder infection, along with fever, which is usually more than 100 degrees, pain in one or both sides of the lower back where the kidneys are located, nausea and vomiting. So how do we prevent it in the first place? Drink water frequently and stay hydrated. Don't hold your urine for a long time. Maintain proper hygiene. When passing urine, wipe from front to back and not from back to front to prevent bacteria from in and around the anus from entering the urethra. If you are using a common washroom, it is a good idea to use Dettol and sanitizers before sitting on the pot. Women who are prone to UTIs should avoid using birth control measures such as diaphragm and spermicidal jelly. In such women, condoms are preferable and you must urinate and clean yourself before and after intercourse. If you have diabetes, maintain normal blood sugar level to prevent recurring UTIs. Cranberry juice has been shown to prevent and treat UTIs. Vitamin C and garlic intake have shown some benefits, though they are not backed by strong evidence. The treatment for UTIs is pretty straightforward. It is mainly done by antibiotics, depending on the type of bacterial infection. Antipyretics and antispasmodics are used for controlling fever and pain. Remember to never self-medicate as the antibiotic that has been prescribed to someone else may not be effective in your case. Do not take medication for a previous infection, as the new infection may be entirely different and may need different set of antibiotics. Also, irrational use of antibiotics leads to an antibiotic resistance, in which the infection stops responding to most antibiotics, and it can also become life-threatening. Always contact your gynecologist for the treatment of a UTI.